This is Dr. Paul with Easy Orthopedics, and today I'm going to answer a question that I get asked a lot, which is, do I need a steroid injection? Well, to answer that, first I think we have to know kind of what's in a steroid injection. So usually there's two components. One is the corticosteroid. Um, so that's different from an anabolic steroid. An anabolic steroid is what weightlifters and bodybuilders use illegally to get really, really large. This is totally different. Sounds the same, but totally different. This actually decreases inflammation, the corticosteroid does. So you can take it in pill form, but we use it in injectable form because it gets right where the inflammation is instead of having to go to the entire body, because there's side effects when it goes to the whole body. So that's one thing that's in there. The second thing that's usually in a steroid shot is some sort of numbing agent. I like to use 1% lidocaine without epinephrine, although people will use other sort of injectables like that. And what that does is that does two things. The numbing agent, one is it spreads the steroid around. So sometimes the steroid doesn't take up a lot of volume, and this helps kind of distribute it. The second thing is it can provide immediate pain relief. And so if you're injecting an area to see if someone will get better, and they get better immediately, you know that you're in the right spot, and you know that the steroid injection will likely work. So that's usually the combination of a steroid. There's different amounts of steroids and different amounts of lidocaine that you can put together, depending on where in the body it is and the doctor's preference, but that's what it is in a nutshell. And the course of it is that usually the numbing medication will work right away, and then it takes a few days, and then that'll wear off shortly afterwards, usually same day, maybe sometimes the next day. And the steroid will take a few days to kick in. So somebody will commonly say, oh, it felt really good, but then later in the day, well, I don't really know so much. And then a few days later, they'll say, hey, it really started to feel good. So that's what a steroid injection is. So when should you use it? Well, it depends what's going on. In some instances, a steroid injection can actually be curative. So if you've got a trigger finger, which if you don't know is when your finger stops moving normally and can get stuck, that can be curative. You got tennis elbow, it can be curative. Sometimes for shoulder bursitis, it can be curative. I like to use it a lot for shoulder bursitis in combination with physical therapy. It can really decrease the pain and help you get a lot more out of the physical therapy. So in those instances, for a tendonitis or bursitis, it can cure it and take the pain away entirely. So those can be good indications for it. Now, another reason people use a steroid injection is for arthritis. So if you've got knee arthritis, knee injection is super common. Now, what does that do? Is that injection getting rid of your arthritis? Absolutely not. Your arthritis is still there. It's almost like a Band-Aid in that case. But some people get really good relief from it. Some people get a few months of relief, up to a year of relief. And of course, some people don't get any relief at all. Just depends on you. And that can be really hard to predict. Some people love it, and other people say, I didn't get anything out of it. So that's kind of what the steroid injection is used for. So what are the side effects? Well, there's rarely, someone can have an allergic reaction. Sometimes people get something called a flare reaction where it hurts pretty bad for 2 days. Some Advil and icing will help with that. Occasionally, rarely, it'll thin the fat, or if you're darker skinned, it can, discolor your skin. There's the theoretical risk of infection. I've never seen it. We do it all sterilely. The risk is super low for that. And overall, the risk for the injection is pretty low. Oh, if you are diabetic, it will raise your blood sugar, so you need to be careful about that. But it's one of my more common tools that I use, and I think it can be extremely helpful. So if you're thinking about getting one, I would say definitely look into it. But just make sure you have an accurate diagnosis from your doctor or provider, because if you don't, then it doesn't matter what you inject, you're not going to get better, because you're not treating the problem appropriately if you don't know what it is. So that's my advice. Thanks for listening to my video. If you have any questions, you can leave them in the comments below, and I'll try to respond. Otherwise, I'll be making more of these, and I hope to see you again soon.